Truck after truck, this convoy marching through an Italian town, each filled with caskets. This eerie scene unimaginable just weeks ago. Italy reaching another horrifying milestone, more dead there than even in China. And here at home, there are now more than 13,000 COVID-19 cases. The FDA is fast-tracking the trials of possible treatments as communities plan makeshift hospitals in case what happens in Italy happens here. The mayor of America's largest city says the Big Apple is seeing an explosion of cases, lashing out at the president to do more.
There will be people who die who didn't need to die.
Adding the city only has a 2 or 3 week supply of vital medical supplies left. New York's governor with his daughter by his side, angry at young people ignoring health warnings, both upset about scenes like these in Florida.
The risk does not justify the reward.
Miami now closing its famous beaches, and the unemployment numbers nationwide continue to soar. What to do if you've lost your job but still have a car payment to make? And with so much negativity, we're also looking for the positive. So many selfless people working to make a difference and shine a light in the midst of this global emergency. Good evening, everyone. I'm Lindsay Davis. Thanks so much for streaming with us as we find ourselves in the midst of a pandemic, the likes of which we have never seen before. Tonight, we're going to dig deeper into what we can all do right now. The entire globe is trying to come to terms with a new way of life, because at this point, this is way beyond hotspots on a map. Here in the U.S., the number of confirmed cases, they continue to rise. Large sporting venues like Citi Field here in New York, they're being transformed into makeshift triage zones in anticipation of a crush of COVID-19 patients. This is an effort from coast to coast. This soccer complex in Washington state also turned into a temporary hospital. The entire nation of Italy is on the brink and on lockdown as the death toll now surpasses that of China. And the defiant spring breakers on America's beaches, initially refusing to stay indoors, now they have no choice but to get off Florida beaches. They're forced to come to terms with this crisis, as so many of us are right now. Our Whit Johnson leads us off with the very latest.
With the number of infections in the U.S. soaring, in New York alone by 3,000 in just the last 24 hours, the mayor giving this new warning.
But the federal government does not do all in its power immediately. There will be people who die who didn't need to die.
Adding this is going to be one of the most difficult moments in the city's history. This as the White House is making an ambitious promise to fast-track medical treatments for patients with COVID-19.
It's shown very encouraging, very encouraging early results. And we're going to be able to make that drug available almost immediately.
President Trump touting the malaria drug chloroquine, or hydroxychloroquine, which doctors say have already delivered promising results in China to alleviate symptoms. But right now, the FDA is still studying the drug.
I think it could be a game changer, and maybe not. But I think it could be based on what I see.
The White House says another therapy for Ebola is already being tested on Americans with COVID-19. But it's still unclear when any of these treatments will be widely available or if they're effective. This as doctors and nurses have been sounding the alarm for days, saying they're running out of critical supplies. The CDC even recommending using homemade masks like a bandana or scarf as a last resort.
Nurses are working with inadequate protections, and that ranges from head coverings, respirators, eye shields, appropriate gowns.
But Vice President Pence claiming a company that makes those vital N95 masks is ramping up production to 35 million per month, adding that the government has now identified tens of thousands of ventilators as well. ER Dr. Stephen Anderson telling us they need ventilators in Auburn, Washington.
We need ventilators. I have ventilators this morning, but the hospital up the street from me is out of ventilators at the moment.
The growing pandemic now revealing the risk for young people may be worse than previously thought. New numbers from the CDC showing nearly 40% of American patients hospitalized for COVID-19 were between the ages of 20 and 54. Still, thousands of college students have been descending on Florida beaches. But 29-year-old Tarek Soleiman wants young people to realize just how dangerous it is. He's sick with the virus and has pneumonia, unable to breathe.
I just want to say that it can come to anyone, and it can also be severe for a lot of young people.
The governor of New York today leaning on his 22-year-old daughter.
What is the one line I used to say?
Risk reward.
Yeah.
to urge young people to heed the warnings.
These pictures of young people on beaches, these videos of young people saying, this is my spring break, you know, I'm out to party, this is my time to party. This is so unintelligent and reckless.
In New York, Governor Cuomo now tightening the restrictions on businesses, mandating that 75% of their workers must stay home. And in nearby Freehold, New Jersey, an unimaginable loss for the Fusco family. Today, the fourth member of the tight-knit family dying, all within days of each other. 3 others hospitalized, nearly 20 family members now on quarantine. Daughter Bridget telling People magazine, "I am numb. I don't believe what is going on."
And Whit Johnson joins us now. Whit, such a tragedy for that family, and some of them are still in the hospital.
That's right, Lindsay. At least 3 of them still in the hospital. We know that 20 or more are now on self-quarantine as a result, and that number could go up depending on how many people they've had contact with. But this is really an unthinkable example of just how contagious this virus can be, especially in large groups. The New York Times is also reporting that matriarch died while on a ventilator in the hospital, never knowing that her 2 oldest children had already passed.
Really
Lindsay?
Unable to mourn properly together the deaths of their relatives and loved ones. Whit Johnson, thank you for that. And now to the scramble to accommodate patients as cases continue to soar, while President Trump and Vice President Pence assured government officials earlier today that critical supplies such as masks will now be made readily available. Makeshift hospitals and testing sites are popping up across the country. This as hospital and healthcare workers brace themselves for the incoming wave of patients expected now that more than 13,000 cases of the virus have been confirmed in the U.S. Here's our chief national correspondent, Matt Gutman, with more.
Tonight, one of the biggest expansions in hospital space in American history. From coast to coast, temporary hospitals being built at breakneck speed. This field unit for coronavirus patients under construction on a soccer field outside Seattle. In Florida, equipment for 3 mobile hospitals arriving. And this as emergency room officials fear being overrun when the virus peaks.
We have patients who we suspect highly have COVID, but have not been, the testing is not completed because the testing is taking so substantially long. Our ICUs are already at capacity before this pandemic began, and now we're pushing them over.
While thousands are lining up at drive-through testing sites like these in Texas and Georgia, so many seeking tests are unable to get them.
I was sitting on the couch, and my wife was in the kitchen, and I almost passed out, just out of the blue.
39-year-old Sacramento resident Justin Willite has been to the emergency room twice in the last 8 days. Doctors tell him they are 100% certain he has the virus, but they told him the tests are only for those in dire need.
It was more frustrating for my wife because my wife wanted more definitive answers.
With officials in Los Angeles setting up this RV park as a possible quarantine site, doctors across the country now pleading with people to stay home. This physician in Atlanta holding up a sign saying, "I stayed at work for you, you stay home for us," especially since some of those doctors on the front lines are especially vulnerable too.
I can't walk away from this pandemic while I'm needed. But that said, I have at least a 10-fold higher mortality rate.
Some hospitals reporting a short supply of ventilators. Doctors in other countries have rigged them so patients could share them, but haven't taken that measure yet. That is now being discussed as a last resort among some health officials.
We're exploring how to make that work, and that creativity is absolutely essential.
And Matt Gutman joins us now. Matt, as we heard in your report, ventilators are crucial in treating COVID-19 patients. Is there a real concern that we may simply run out of them in this country?
Oh, there absolutely is. I mean, if present conditions continue and the number of cases spikes, and we just had Governor Newsom talk about 25 million plus cases in California alone, we could very well see this run on ventilators. But we have to say that even though it is very promising that they may be able to split ventilators, have multiple patients on each one, that's still a little bit risky because it's never been tried before on people. You need skilled technicians to be able to monitor each of the patients. There's a concern that they could transmit diseases between one another because they'd be sharing the same air. So this is not a foolproof system. It is something all clinicians hope to avoid, but if push comes to shove and they have to, it will be a last-ditch effort that is obviously being considered very seriously right now. Lindsay.
Matt Gutman, thank you for that report. As the outbreak spreads, the State Department is warning Americans to avoid all international travel under any circumstances. They also are urging people to return home if they're already overseas. Joining us now is Chad Wolf, Acting Secretary for the Department of Homeland Security. Thank you so much for joining us, Chad. We appreciate it. So can you give us a sense of how these restrictions are actually going to work? Is this something that you can enforce or just a guideline?
Well, no, these are actually restrictions. So again, the Department of State put these out. Every American should certainly adhere to these restrictions. And again, asking you not to travel, and also really the restrictions that the president put in place for over 30 countries that we have in place now. Again, Americans are returning home. They can continue to return home under these restrictions. We'll again identify them, look at them medically, and do a number of checks as they come back into the country. So that's what we're doing now. DHS and CBP have screened over 150,000 folks thus far, and we'll continue to do that.
Now, this only impacts international travel. What about domestic travel? Will we possibly see any restrictions there?
Well, we'll continue to look at domestic travel, again, as our medical strategy continues to evolve. Right now, we have no immediate plans for restrictions on domestic travel, but we continue to say that all options are on the table to deal with the virus.
The president has already announced the closure of the Canadian border to non-essential traffic. Will he do the same with Mexico?
Well, we're certainly taking a look at that. And again, what the president announced was not closing the border on Canada. This is actually talking about keeping the border open to essential travel, to that trade and travel, that economic trade, the commerce that we need to keep the economy going. So we're certainly doing that with our Canadians. We hope to reach an agreement here within the next hours to days with our Mexican counterparts, again, to do very similar restrictions on our southwest border.
Now, we saw how China reacted with a massive shutdown, and we saw how Italy has responded with some gradual quarantines. Now there are more deaths in Italy than in China. Does the U.S. government need to be more aggressive and maybe consider a mandatory 30-day shutdown, or what do you perhaps have in your toolkit?
Well, the task force meets every day, and we are being very aggressive with the guidelines, the information that we're putting out across the board. And I will just say that the president has been very aggressive on this front, and we really took unprecedented actions in stopping travel from China, Iran, and additional 26 countries in Europe. And we'll continue to look at additional travel restrictions as we need to. Here closer to home, we're starting to do that with Canada and with Mexico, and we need to look at all travelers that are coming into the country, both through legal ports of entry and illegal ports of entry and illegal means. So we're certainly doing that. We're going to continue to lean forward aggressively, making sure that we're protecting the American people. We're protecting the DHS workforce and the officers on the front lines. These are officers that are also every day, in addition dealing with the coronavirus, are also keeping out terrorists, drug smugglers, narcotics traffickers, and everything under everything. So we need to make sure that they stay healthy, they stay safe, and we need to put measures in to do just that.
Why so much mixed messaging coming out of the administration? 2 weeks ago, we had the HHS Secretary Azar on, and he told me, quote, "There is no testing kit shortage, never been a time where tests were unavailable." Knowing what you know now, do you think that that was in any way accurate?
I do believe it's accurate. So I think we continue to work the testing front. Again, the task force is solely focused on this. We have a number of individuals on the task force that are leaning ahead. And again, we have testing not only from CDC, but also our the commercial labs out there as well. So we're hitting it on all fronts. There's a lot of information that we pump out every day. The vice president is solely focused on this issue. We provide information every day about new testing locations. We have the drive-through testing facilities that we're rolling out. So we're doing more each and every day and providing more testing capabilities to every governor that needs that. What you saw today when the president visited FEMA was making sure that that emergency response capability that FEMA has, that they exercise over 47 to 50 times last year in a major way, is now being put against this effort. So the states, the governors out there, they know exactly how that process works. Their emergency operations centers, their emergency managers know exactly how that works with FEMA. So we're continuing to improve that process. We now have FEMA leading the coordination for the federal government, and I think you're going to see even more and more progress every day.
But just to follow up on that for a moment, we have heard from governors. We talked to Senator Manchin just the other day. He said that West Virginia, they only had 500 tests for the entire state. There are concerns about swab shortages, which would allow you to not even be able to perform tests if necessary. And there are requirements, like everyone who wants a test can't get tested. And I think that we've seen that it's like 3 out of 4 people are asymptomatic, and they don't know that they're passing it along because they can't get tested.
So what I think folks need to appreciate is we need to make sure that we are providing the supplies, the testing, all the information and the materials to the most affected areas in the country. And so that's our strategy. That continues to be our strategy. So places like West Virginia and others that have a very low case amount, we need to make sure that the folks in Washington State and California and New York and other places, making sure that they have the information, they have the materials, they have the swabs, the tests, to make sure that we continue to focus on areas that need it most. We'll continue to make sure that all 50 states, all territories have the information, have the test, have the swabs that they need. And again, we're working with our commercial partners to do that. And we're just doing that. We're making progress every day. And again, the task force, we hold regular press conferences, regular communication with the American people, providing that information.
FEMA, of course, falls under DHS and was only recently mobilized to respond. Why didn't that happen sooner?
Well, they've actually been mobilized from the start. So they've been there providing that resource and that support to HHS. The NRCC has been activated for some time. What I think you've seen now is they've been activated to a level 1, which is what we would normally do in a major hurricane, natural disaster, or man-made disaster. And so they are leading the federal coordination. They'll continue to rely on HHS and the medical experts and their opinion to drive that. But what we're utilizing FEMA for now is to making sure to provide that coordination. And again, governors in all 50 states, territories know what that process looks like. Their requests can go through the FEMA pipes and channels. They'll get evaluated, and the information and the resources that they need will get back to them very quickly.
All right, Secretary Wolf, we appreciate your time. Thank you so much.
Great. Thank you.
The coronavirus has not only attacked the health of thousands, but also threatened the livelihoods of millions. Day by day, businesses are being forced to make drastic changes, reduce hours, or close altogether. Markets today were able to gain a little ground after a week of steep declines, the Dow closing up nearly 1%. But the damage to the job market is laid bare as applications for unemployment benefits surged by 70,000 last week, something that's only expected to get worse. ABC's chief business and economics correspondent Rebecca Jarvis has the details.
Tonight, the coronavirus emergency is taking its toll on the American workforce.
COVID-19 is an economic tsunami.
In San Francisco, a city under orders to shelter in place, housekeeper Larry Lou Karumba hasn't worked in 2 weeks.
I'm a single mom of 3. I really don't know what I'm going to use to put food on the table.
Across the country, unemployment claims are soaring. In Pennsylvania, 121,000 claims in 2 days. Minnesota handling 2,000 claims an hour this week versus 40 an hour just last week. And in Massachusetts, nearly 20,000 claims on Monday, more than all of February.
Last time for a while.
Among the hardest hit, the service industry. At least 21 states have closed restaurants and bars to dine-in customers. Christy Oakes is a server in Boston.
Because we do work on tips, a lot of us are left with little to no income.
By one estimate, more than 9 million people could be affected just by bar and restaurant shutdowns alone.
Our thanks to Rebecca Jarvis. And in Washington, lawmakers continue to grapple with just what to do. A potential $1 trillion rescue package is beginning to take shape. Senate Republicans and Democrats floating emergency plans to give many Americans $1,200 to help ease the financial pain of this moment. The president today discussed his bailout plans for individuals, businesses, and industries hardest hit, but leaving unanswered questions about whether strings would attach to large corporate bailouts. Jonathan Karl has more.
Tonight, Senate Republicans in the White House introduced their trillion-dollar plan to boost an economy battered by the coronavirus.
Can you still get this done, like, early next week if all of these...
We don't. We're going to get our ass kicked.
The plan includes relief for workers, small businesses, and the industries getting hit hardest, including airlines, cruises, and hotels.
Will you guarantee that the money, the billions, the tens of billions of dollars, hundreds of billions of dollars even, that's going to go to these industries will not go to executive bonuses or to more stock buybacks?
Well, we don't want that. In fact, some companies, as you know, did stock buybacks, and I was never happy with that. It's very hard to tell them not to, but I would tell them not to.
You can make it a condition of the bill. You could say that none of this money can go for that.
I'm making, I mean, you know, it takes many people in this case to tango. But as far as I'm concerned, that conditions like that would be okay with me.
A big chunk of the bill would be cash payments to individual Americans. If you make $75,000 or less, you'd get a $1,200 check. Anyone making up to $99,000 would get a smaller check. And families with household incomes under $198,000 would get up to $500 per child.
And John Karl joins us now from the White House. John, you pressed the president today on whether proposed taxpayer-funded corporate bailouts could end up going toward executive pay or stock buybacks. What are the concerns?
Well, the concerns are that, particularly in the airline industry, these are companies that, while times were good and times have been very good for the airlines, they were using their excess profits not to prepare for something like this, but instead to have stock buybacks, using the profits to buy stocks and therefore boost stock prices. And also you saw big bonuses for executives. But the president said that he is all in favor of restricting federal funds that would be used to help these companies to make sure that they could not be used for either executive bonuses or stock buybacks. And I am told, Lindsay, although I have not seen the text yet, but I'm told that the proposal unveiled by Senate Republicans, in fact, does include restrictions on the use of these funds to make sure they cannot be used for either bonuses or buybacks.
And, John, there seems to be an urgency around getting an emergency measure passed. But how will this play out on Capitol Hill with new coronavirus restrictions?
Well, it's going to be a challenge. I mean, we've had already 2 members of the House test positive for coronavirus. That's just 2, but we've seen the pattern. If that were to extend to many more members, there is the question of how this vote could be held. Now, there are proposals, Lindsay, that have emerged in the Senate and discussions in the House that would allow for remote voting for the members of Congress to vote from home, essentially. But I am told up and down that those proposals are extremely unlikely to go anywhere. It's even questionable whether or not they are constitutional. Instead, what this does is it really raises the importance for getting overwhelming bipartisan support for this measure, so that if we are in a situation where several members of Congress are unable to vote, these bills would still be able to pass.
All right, Jonathan Karl from the White House again for us tonight. Thanks, John.
Thanks, Lindsay.
And when we come back, the party is over. That's the message from Florida's governor to spring breakers as concerns grow that some young people aren't taking this crisis seriously enough. Italians heeding the warnings to stay at home as the country reaches a grim milestone, and the crisis in Spain is also rapidly deepening. And here at home, we are tracking severe storms crossing the country.
The most powerful stories of our time, anytime. Nightline.
Your mom said, comb your hair. Your dad told you, smarten up. Your dog is judging you right now. And your best friend just called you crazy. We all need someone who'll pull no punches and give it to us straight. Now imagine getting your news like that. No bull, no spin, just give it to me straight. Straightforward news, straight to the heart of the story. ABC News, straightforward.
In one place, the vital information, the straightforward facts, what you need to know, helping you protect yourself and your family. ABC News Live, COVID-19, what you need to know, streaming everywhere.
I still see photographs and videos of people sitting in outside cafes all over the world and having a good time and hanging out in crowds. That is not wise, because that's how you can get the virus. That's how you get it, by contact with other people. So stay away from crowds, stay away from being in restaurants and outdoor cafes, especially now in springtime where all the kids are going to the beach and celebrate and drink and all that stuff. This is not a good idea. So stay away from the crowds, go home, and then we can overcome this whole problem, this whole virus in no time.
That, of course, was Arnold Schwarzenegger from his jacuzzi, cigar in hand, telling everybody to stay at home, especially the spring breakers that we've seen crowding many of Florida's beaches this week amid the coronavirus pandemic. But these shoreline destinations in the Sunshine State have been closed off, disappointing defiant spring breakers and providing some relief for frustrated locals. Our Victor Akendo spoke with some of them, and he joins us now live from Miami. Victor, what's the latest on the beach closures?
Well, Lindsay, this is the new norm here on Miami Beach for the time being. Miami-Dade's mayor ordering that all parks and beaches shut down. You can see that there are still a few people out here going for a walk. Actually, a pretty good-sized crowd right now. But just beyond me there, we see those two patrol cars. That is the entrance to the beach. The sand is just beyond them, and there is no getting by those officers. You'll see a lot more of that up and down the beach here. We watched as disappointed spring breakers in bikinis and board shorts flock to the beach only to be turned away. And realistically, they don't have too many options right now. Like so many other cities, the bars are closed unless they serve food, in which case it is takeout only. Some spring breakers, they understood the situation. They're trying to make the best out of it, trying to avoid big groups. Others are determined to have a good time, regardless of the consequences to everyone else. And the locals are fed up. How packed has the beach and the park right here been?
It was pretty packed, the beach. The problem was that we had a lot of people from spring break over here, so it was very crowded.
You had a lot of people here for spring break?
Yes.
Did that make you all nervous to have that many spring breakers here?
Absolutely, yes.
Terrible.
There's
Everything
nothing to
is
do.
closed.
The curfew, there's nowhere to eat.
Nowhere to eat. Like,
nothing.
Everything is closing early. If it's not even open, like, it's just terrible.
Now let's get to these images out of Clearwater Beach on the other side of the state. This shows a much different story. Packed beaches there, infuriating those who are being responsible and social distancing. Originally, Clearwater Beach was supposed to close on Monday. Change of plans. Now those beaches will close Friday at midnight. Lindsay?
And Victor, given the state's large elderly population, I imagine there's great concern among Floridians who are there in their homes.
Absolutely, Lindsay. We're talking about nearly a quarter of the population here in Florida is above 60. Now, being out here for the last 30 minutes or so, I can tell you we have seen some people in that age range, but we also came across a couple men just 2 blocks away. They were standing on their balconies. They did not want to come down to street level at all. They were actually shouting, urging these spring breakers to stay inside. Quite frankly, right now, those beachgoers are just making a bad situation even worse.
Yeah, lots of people still out and about behind you. Victor Akendo in Miami for us. Thank you for joining us tonight. And joining us now by phone, Florida Senator Rick Scott, who was, of course, also governor there for 8 years. Senator, thanks so much for joining us tonight.
Well, it's pretty disappointing, isn't it? These people are irresponsible. They're stupid. They're selfish. We're all in this together, and we got to take care of each other, and they're not. So these people need to get off the beach unless they can go. There's probably times where the beach isn't busy. Maybe you can go then, but get off the beach.
Now, you are definitely trying to keep yourself safe and others. You've been in quarantine for more than a week after being exposed to the Brazilian delegation that tested positive for coronavirus. First off, let's just ask, how are you feeling?
I'm feeling great. I've learned to take my temperature. So I do that about every 3 hours. I know I'm generally at about 97.5. I've been talking to the stint doctor, my own personal doctor. They said the first symptom is fever, and so I haven't had a fever. I think I have until Monday morning at 9 o'clock. So that will be 14 days. So I look forward to eventually seeing my wife and my kids. But I'm going to do the right thing because I want to make sure I don't infect anybody, and everybody ought to be doing that. Lindsay, what are we doing? We're doing social isolation so this thing stops growing, so it gives us time to figure out how to take care of patients and how to make sure we get a vaccine. That's what we're doing. That's what we all should be doing.
Now, you say that that's what we all should be doing. You know, President Trump was with the same Brazilian delegation. He is not self-quarantining. Do you believe that he should be?
Well, I was at the same event he was, so I don't know if the individual that was tested positive was with him, and the Brazilian president said he's not. He tested negative, so so I wasn't there. But I can tell you, we all have to take this seriously. Look what it's doing to our economy. And look at how many people have passed away around the world. And by the way, Lindsay, just think about what we can learn from Taiwan. One person has died. We can learn from South Korea. Less than 100 people have died. Or we can become Italy, where 3,000 people have died. I want to be like South Korea and Taiwan. I love my family. We all love our families and our friends and people we work with. So take this seriously.
And, you were governor, as we mentioned, for 8 years in Florida and have experience taking measures during so many hurricanes. In an interview this morning on Fox News, Governor DeSantis said, quote, "The message, I think, for spring breakers is that the party is over in Florida." But is he doing enough to end the party?
Well, I think at every level of government, and look at reality, Lindsay, whether it's the governor or whether it's the mayor, in every jurisdiction around the country, people have to make sure there's social distancing. We all do. We've got to do everything we can. Florida issues the beaches, right? But it might be someplace else. It might be a lakefront place in some other state. All of our governors, all of our mayors, everybody's got to stand up and do the right thing here. I want to get through this. I know we can get through this if we work together. That's what I'm working on.
How would you rate the federal response to coronavirus so far on, let's say, a scale from 1 to 10?
Well, I don't know. I'm not sure how you can rate it, but here's what I like, and here's what I think we need to do more of. I like the fact that we didn't allow people to fly in from China. That was really helpful. But right now, we have got to, and I'll tell you what I've been working on since I've been here. I mean, every day. I want to get this border secure. I want to get these testing sites up. I mean, I've been talking to people all across my state and people all across the country because I used to run a large hospital company. Some of them don't have swabs. Some of them don't have the reagents. Some of them don't have the vials. Some of them don't have the kits. We have to get together and we have to share these resources so we can save everybody's life. But you know what's really important is we got to keep these healthcare workers safe. So I was talking to the head of 3M today. What can we do? Talking to Surgeon General today. What can we do to make sure we get more protective gear out there? So we've got to keep figuring this out.
Earlier in the week, the president asked individual governors to deal with getting respirators. Does Florida have the supplies that it needs?
I don't think. I think that as I talk to people around the country, not just in Florida, they're not out, but they're having to use things longer now. So that's why I talked to 3M about how can we get more things out. Now, legislation that was passed is going to allow, I guess it's industrial respirators to be used in the healthcare, which is really good. The other thing, when I talked to the Surgeon General today, by closing down elective surgery, that should save some. But one thing is, by getting rid of elective surgery, then there's locations that are not going to be doing surgery. So can we use that? Can we share those resources? We have to. So the whole healthcare system, they all have to come together to figure out how do we do what's important now. Where do we need the resources now? Let's do that. Let's save lives and let's prevent people from getting coronavirus. We do, more people's lives will be saved until we figure out what treatment. I'm hopeful that there'll be a treatment that we figure out, and eventually we get this vaccine. That's what we're fighting against. We're fighting against time.
We just heard from the DHS secretary, and he said that there is no shortage of testing kits. Is that true in Florida?
What they've said is, it depends on who you talk to. I was talking to the healthcare district of Palm Beach, and they had the protective equipment. Their issue was making sure they got more tests. Then I talked to somebody else. Their issue was to get more reagents. So that's why I'm trying to get everybody to share and talk to each other. So we all have to do that. We have to figure this out. So what they say is there's more tests out now. But the other thing, Lindsay, it's not just tests. We got to figure out, how do you streamline this? The way I think about it, it's a production line. Do we have each piece of the production line, and then how do we accelerate the results? How do we get to where you go in and hopefully within hours you get a result, so whether at that point whether you need to be quarantined or not, and at that point whether you need to call everybody you come in contact with and tell them they need to be quarantined. That's what we've got to get to as quickly as we can.
And just lastly, beyond just the virus itself, there's the unprecedented economic effect. I mean, Americans are worried tonight. Miami certainly isn't a cheap city to live in. Are monthly checks for about $1,000, $1,200 a month, or for one-time payment, or perhaps 2 times? Let's say for a bartender there who may be out of work indefinitely and unable to pay for rent and food and other costs of living. Is that enough?
Lindsay, what I've focused on and I've been talking about is we've got to get to the worker the hourly worker, the tip, the person relying on tip, those people as fast as we can. How do you get them? How do you get there faster? One, make sure we have a robust unemployment system, which we do. In Florida, we have $4 billion sitting in the bank, so you can do that. Number two, we ought to say to them, you make less than $75,000 a year. If you want to postpone your rent, your mortgage, your utilities, your taxes, you can wait, postpone it for 60 days and pay it out over the next 12 months after that. Do the same thing for our small business. That's how we'll get money faster to the people that need it the most. It's the hourly workers, the tip workers, the small businesses. That's how we'll get money to them fast. That's what we need to be doing.
Senator Rick Scott, thank you so much for your time.
Thanks, Lindsay.
And when we return, the chilling new video from Italy's front lines. And the car companies offering payment options to those suddenly out of work. And our tweet of the day, the first person from the NFL testing positive for coronavirus. New Orleans Saints coach Sean Payton expressing his gratitude to those who have reached out.
In times like these, the news-making events happen here. ABC News.
President Trump meeting face-to-face with one of the world's most brutal dictators, Kim Jong-un.
The president.
You trust him? I do trust him, yeah. I think he trusts me, and I trust him.
Ivanka Trump.
I have to ask you about your emails. Your father had taken Hillary Clinton to task for this.
There just is no equivalency.
So the idea of lock her up doesn't apply to you?
No.
Comey.
How strange is it for you to sit here and compare the president to a mob boss?
Very strange.
Michelle Obama.
What do you wish you could tell your pre-White House self?
Whew. Melania Trump.
Do you think there's still people there that he can't trust?
Yes.
Still working now?
Yes.
Michael Cohen.
So he's still lying?
Yes.
It's a big statement.
And now, in a year with so much on the line, we're right there.
Good evening tonight from Washington, a very busy news night.
America's #1 news source, ABC News, straightforward.
Welcome back. In Italy, a terrible milestone. The death toll from COVID-19 in that country now more than 3,400, surpassing the death toll in China, despite Italy's much smaller size. Our James Longman reports from London.
Tonight, chilling new video from Italy's front lines as a deadly milestone is reached. The country today recording more coronavirus deaths than China. Over 3,400 now dead, 427 more fatalities in just one day, and a 15% increase in infections over yesterday. The curve just won't flatten. This desperate plea from a doctor in hard-hit Bergamo.
We are in full emergency. Our health personnel, nurses and physicians are working round the clock, countless hours to fight this incredible situation.
Tonight, 300 volunteer doctors now being rushed in from other parts of the country to help. Even Bergamo's crematorium is overwhelmed. Bodies now have to be transported by the military to surrounding regions to be dealt with safely. This nurse saying the psychological tension has, quote, gone through the roof. We're not even counting the dead anymore, she says. Doctors also making the ultimate sacrifice. One physician, sick with the virus, reportedly didn't want to take an intensive care bed from another patient. It cost him his life. Americans in Italy warning of the dangers to loved ones back home.
You don't realize who you're going to come in contact with next. You could be a carrier and not even know it.
Darkness in Italy and Spain, suffering nearly 300 deaths in the past 24 hours. But glimmers of light from China, reporting no new domestic cases. A long road ahead for other nations facing corona's deadly wave.
And James joins us now. James, we've been so focused on Italy, but cases in Spain are now exploding as well.
Yeah, that's right, Lindsay. It is now the second hardest hit country in Europe after Italy. Today we heard 294 more deaths in the last 24 hours, bringing the total in Spain to 803. And shockingly today, one official was quoted as saying that he believes that Madrid could see an 80% infection rate of coronavirus in the city. That is the capital of Spain. That is quite extraordinary when you think about it. So a national lockdown is in place, like the one we've seen in Italy. Actually, the Spanish authorities are using drones to try to make sure that people stay out of public spaces. All public spaces have basically been closed down. All shops, libraries, university, everything is shut in order to stop this thing from spreading. Spain also faces a number of challenges like other European countries do, namely its population is on the older side, like here in the United Kingdom, like in Italy, an elderly population very much in danger. Also, austerity across Europe bit hard, particularly on the health system in Spain, so that is a challenge for them. And the way that the health system is structured in Italy, it's very much regionalized, so it's going to be very difficult for them to get a picture of just how much this virus is spreading and how to combat it. A lot of challenges ahead for Spain. Lindsay.
James, thank you for the snapshot over there, and we'll be coming back to you later in the show for some much-needed positive news. We'll see you then. And when we return, a popular Amazon program is being halted for now. The details in just a moment. And later in the show, we're going to take a step back and focus on the many out there doing great work in these very uncertain times. But first, here are some of the trending stories on abcnews.com.
Seeing right now, this is part of the eye wall. This procession of migrants goes back 2 miles.
There is going to be catastrophic damage.
This fire has made a run. You can see those flames shooting up into the sky.
We are on the jam-packed red carpet.
To the right, guys. So this is the 4th weekend of protests.
Watch ABC News on location for Facebook Watch.
What's the most innovative daily news podcast out there to listen to every day? Well, the Edward R. Murrow Awards say it's Start Here, the daily news podcast from ABC News. Even the New York Times calls us a top news podcast worth listening to. So if you like getting behind the biggest news stories of the day, inside all the details, the backstory, and what will happen next, then listen to Start Here, the daily news podcast from ABC News. It's like no other news podcast out there. Even the critics agree. Listen free on Apple Podcasts.
As more mobile COVID-19 testing sites pop up in parking lots across the country, the White House announced a malaria drug called chloroquine is showing promising results.
And it's shown very encouraging, very, very encouraging early results. And we're going to be able to make that drug available almost immediately.
A potential breakthrough, but the FDA later clarified that chloroquine was not yet approved for the treatment of COVID-19. In an effort to reduce the spread of the infection, the mayor of Miami-Dade, Florida, ordering the closure of all beaches, parks, and some non-essential businesses in the county. And in New York, the state with the most number of cases in the country, the governor says there are no plans for a shelter-in-place order.
On Wall Street, a rather subdued day, but the major indexes closed slightly higher.
After signing a $100 billion stimulus plan into law, the president is also pushing Congress to approve another $1 trillion package to help the economy, which could include 2 rounds of checks sent to most Americans.
The American people need help.
Even as 2 of their own test positive for the virus, Republican Mario Diaz-Balart and Democrat Ben McAdams, lawmakers on Capitol Hill are scrambling to pass that aid. Unemployment numbers are projected to spike. Applications for unemployment benefits surging by 70,000 last week.
The situation continues to deteriorate in Italy. There are nearly 500 new deaths, more than 4,000 cases of coronavirus reported in the last 24 hours.
That is the deadliest day anywhere in the world. Videos from inside hospitals show ICU units packed with patients, doctors and nurses overwhelmed with space and equipment running out. Beds are a particular issue, an important lesson for the US because Italy has more beds per capita than the United States.
There are tornado watches across 10 states, from Texas to Indiana. At least 8 tornadoes reported in Texas alone, homes and buildings damaged. Severe storms from Dallas all the way up to Chicago, thunderstorms rolling into the Northeast tomorrow.
47 million Americans are in the storm zone across the Midwest after 8 tornadoes ripped through the Dallas area yesterday. Crews spent the day cleaning up the damage and debris. And tonight, there's a risk of damaging hail, flash floods from Texas to Ohio, tornado watches in 10 states across the Midwest. On the backside of this system, it's heavy snow and blizzard conditions in the high plains, and Denver is under a winter storm warning. Word from Amazon today that it is no longer accepting new orders for its pantry service. According to a spokesperson, they are stopping while they work to fulfill new orders and restock items. they're working quickly to make products available again. The news comes after an Amazon employee from a delivery station in Queens, New York, tested positive. That station has now been closed for deep cleaning, and the employee is under quarantine. And late last night, the CDC released new data showing that nearly 40% of the people hospitalized with coronavirus are under the age of 54. That is more younger people than initially thought who are seriously ill with this virus. For more on that and all the latest public health updates, former U.S. Surgeon General and author Dr. Vivek Murthy joins us now. Doctor, thanks so much for joining us.
I'm glad to be with you today.
So we're seeing these new numbers on the virus in younger people. What do you make of those? And what's your advice to people in that younger age group category at this point?
Well, these new numbers about the impact of COVID-19 on young people are telling us that we are still each day learning about the full effects of this virus. And we have to be very cautious about the fact that we're just getting in the know. For weeks now, we've been saying that it is the elderly and people with chronic conditions that are at the greatest risk. But unfortunately, the message that many have taken from that is that if you're young, you have nothing to worry about. These numbers are telling us a different story. They're telling us that a significant portion of people who are hospitalized are actually young, and not just hospitalized in regular beds, but in intensive care units. We are going to learn more information like this about who's at risk, and we've just got to all be cautious and make sure that whether we're older or younger, whether we have chronic conditions or not, that we are taking the precautions we need to protect ourselves, but also to protect other people. We know now increasingly that people who are asymptomatic, they can also spread this disease. And so this is why you're seeing such urgent public health messages come out, because we have to take measures to reduce physical contact between people, to reduce the spread of this virus, so we can protect the most vulnerable.
We also saw President Trump announce today that chloroquine, a drug used to treat malaria, may actually help treat coronavirus patients. What do those diseases have in common that this could make this medicine treat both?
Well, what we have are some small preliminary studies that show that medicines like hydroxychloroquine and like remdesivir could potentially be helpful. The reason I'm caveating this so much is because there's still more that we need to learn to understand if these medicines are both safe and effective for use in patients with COVID-19. That's why you heard the FDA come back actually during today's White House briefing and caution that we should not assume that these medicines are going to be available to anybody who walks into a hospital. We still need to study them. We still need to understand if they're useful. What the FDA is doing, and what the administration, I think, is deserves credit for, is they are trying to accelerate the study of these drugs. They're trying to accelerate the development of a vaccine. And that's important, because right now we have no treatment or vaccine for this virus. And the sooner we get one, the easier and the more quickly we'll be able to protect the population.
And now just a few quick questions that are pretty straightforward, but are likely on many people's minds. As more people start to contract coronavirus, I'm wondering, let's say if I get it, does that automatically mean most likely everyone in my household will get it?
Well, what we know is that this is a very contagious virus. In fact, it seems to be more contagious than the flu. So it's not a guarantee that if you have COVID-19 that everyone in your household will get it. It depends on several things, on their immune system, on how good they are and you are with hygienic practices like washing your hands, covering your mouth with a tissue when you cough, and cleaning off surfaces that could easily get contaminated so that you don't pick them up from that surface. So it depends a lot on your behavioral practices. But I'll tell you that what we do know is that for every one person who gets the seasonal flu, they will pass it on to, on average, 1.3 people. In this particular case, it seems that COVID-19, for every one person who gets it, they pass it on to about 2.2 people on average. That's significantly higher. And so we do have to be careful. This is a very contagious virus.
And as we practice social distancing, is it safer to go out to the grocery store or to get food delivered? And how should we keep ourselves and our products clean in either case?
Well, this is a good question, because we want people to keep their distance from each other. We want them to dramatically reduce physical contact. But that said, there are times you're going to need to go out. It is okay to take a walk, outside, in nature. You just need to make sure you're keeping at least 6 feet between you and other people, and make sure you're not in crowded spaces. But it's also, there are times you need to go to the grocery store. If you do go to the grocery store, what I would recommend is that you make sure you wash your hands when you come back. When you're out, that you do not touch your face. and that you try to minimize how many surfaces you touch, recognizing that every surface is potentially contaminated. If you can get groceries delivered, that's great. But many people cannot do that. You can still go out and try to go out during off-peak hours when the stores are less crowded. And if you are elderly or you have chronic conditions like heart disease, lung disease, or diabetes, call a friend and ask them if they'll pick up groceries for you. There's no reason to take risks that you can avoid if you can reach out for help.
All right. Thank you so much, Dr. Morthy. We appreciate your insight. A staggering number of Americans have lost their jobs or may lose them in the weeks ahead. And here on this show, we see this as more than a job, but a duty and a service. So what we'd like to do is be a resource where we can offer as many solutions as possible for the many people who live paycheck to paycheck. And tonight, we're taking a look at the options for those who have car payments and may not be able to make those payments in the weeks ahead. Our Gio Benitez has some suggestions.
Tonight, as more and more Americans face unemployment in the midst of the COVID-19 crisis, potential financial relief for those burdened with their car payments. Major automakers now saying they will help some owners and lessees. Ford releasing this new ad saying it's been there in times of crisis before and will take calls to help now.
Auto companies clearly know what's going on. They don't want you to default. They don't want to have to repossess these vehicles. I think they want to keep you in the loan. They want you to be a happy customer to come back.
Nissan, Toyota, GM, and Fiat Chrysler saying they will help customers on a case-by-case basis, some of them without accruing interest. For new cars, Ford and Hyundai offering a payment relief program of up to 6 months. But remember, during uncertain times, consider whether you want to take on a new loan now. Either way, experts say automakers are more likely to help, even if you purchased your car before the coronavirus crisis.
The goal for all of these companies is to keep you in the fold as long as possible, and having a happy customer who can make his payments and knowing that you are, out there flexible for the consumer when times were tough. I think that's going to add a lot of consumer goodwill.
If you own a used car, Wells Fargo and Ally Financial, two of the biggest lenders, setting up hotlines to help owners. The key advice, always call the lender first.
I think it's always a good practice to at least start the dialogue, start the conversation. Don't think, I'm not using my car because I'm not going anywhere. I'm just going to stop making the payments. That's probably the wrong thing to do.
And it's very possible that you're going to start getting emails now from people who want to take over your loans. Be very, very careful about that. They may not be legitimate companies. Stick with your lender, because a lot of those other companies, our experts over at Edmunds say, they may be scams, Lindsay. So you just got to stick with those lenders.
And this comes at a particularly difficult time while many people are already financially strapped.
Yeah, listen to these numbers, Lindsay, because they're just incredible. At the end of 2018, 7 million Americans were 90 or more days delinquent on their car loans. So remember, many Americans rely on their cars to get to work. This is especially important now.
And now it sounds like automakers are going to chip in to help with the medical equipment supply shortage.
Yeah, they actually have a long history of doing this in times of crisis. GM and Ford have said that they're looking into the possibility of actually producing ventilators, producing other medical equipment. And we know that Tesla is also looking at the same thing.
All right, Gio Benitez, thank you.
Thank you.
And when we come back, the good news we all so desperately need.
In one place, the vital information, the straightforward facts, what you need to know, helping you protect yourself and your family. ABC News Live, COVID-19, what you need to know, streaming everywhere. Friday nights, 9/8 Central, true crime, cinematic, real-life drama, stunning, the unthinkable. Follow the clues, The Hunt, true crime, 2020, Friday nights, 9/8 Central on ABC.
The world may feel out of your control, but your happiness doesn't have to be. Learn the secrets to happiness. Listen to the 10% Happier podcast, free on Apple Podcasts.
ABC News honored winner of 4 Edward R. Murrow Awards, including the most prestigious honor, Overall Excellence in Television. ABC News, America's #1 news choice.
Good morning, sunshine. Good morning. Good morning. I'm grateful you woke up this morning.
Good morning, sunshine.
Good morning, sunshine. We've been waiting for you. Say good morning. Good morning, sunshine. In America. Say good morning. I want you to wake me up.
ABC News, America's #1 news source. Straightforward news, straight to the heart of the story. ABC News, straightforward.
Hello.
Hello.
Do we have any updates? We have no updates.
Not really.
The only thing is maybe that we got some goodie bags from Princess there with some shirts and coloring books and snacks and stuff that I can't keep together. And Grandpa is looking at photos of dogs.
But we are healthy.
Ish.
We sleep well, but I have to get up early. Everybody has to get up early because the door knocks and the temperatures are taken. But we registered the same. We're normal. It's not going up. It's not going down. Normal.
So they have their swag bags and their health. Checking in, of course, with Michelle Heckert and her family 10 days after they disembarked from the Grand Princess cruise ship. They are officially bored, still doing their laps on the balcony and cleaning the house, but nothing new to report. Still, as always, they are all smiles. And we all need some good news, and at times it is hard to find as COVID-19 continues to spread across the globe. But in the midst of the outbreak, so many are trying to make a difference. James Longman, take it away.
Hi, everyone. There is a lot going on at the moment. Coronavirus kind of feels like it came out of nowhere, and now it's affecting every part of our lives. And it is a scary time. But it's often when we face difficulty that we get to witness human beings doing amazing things. So we want to remind you of just that. A couple of times a week, show you all the extraordinary ways people are responding to the coronavirus crisis around the world. So twice a week here and on our social platforms, we want to do this. And most importantly, we want you to get in touch with us about the stories that are uplifting you. So tweet me at James A.A. Longman or find me on Instagram. You can do the same with ABC News Live. We just want to see what makes you feel good. This is not an effort to minimize what's going on. We just want to keep you company and uplift you along the way. And I'll be doing all this from here on my sofa because, like you, that's where I'm spending a lot of time at the moment as well. So, what's been happening this week? The biggest good news of the week has come out of China, where they reported no new domestic cases of coronavirus. Now, it's obviously tricky to know for sure with the Chinese, but all this began in Wuhan and they built those makeshift hospitals. Well, now they're pulling them all down, and we've seen these extraordinary online video celebrations of healthcare workers taking off their masks in kind of jubilation. We've seen people rushing out to sign the uniforms of health workers as well. Now, it's going to take a little bit more time for China to really know whether or not it's totally clear of coronavirus, but hopefully this means they'll be able to send over some of their life-saving equipment to help other countries, and hopefully it's a sign that we will all one day get through this.
We will strive to help everybody locally in our area.
Now, there are all kinds of stories about neighbours being good to one another, but I wanted to show you this. This is my friend Jim. He owns a pub.
So we just started doing deliveries and takeaways, which we have a team of volunteers that are going to help.
Nice one, Jim. Now, we've all seen these extraordinary videos of Italians out on their balconies singing, playing musical instruments, and it's kind of a trend that picked up around the world.
We all live in unison, and I'm thinking out now.
That was super moving. Now take a look at this. Over in Italy, the water in Venice's canals is now clearer than perhaps it's ever been because of the drop-off in tourists. The sediment at the bottom of the canals is no longer being churned up by the gondolas. So now you can see fish swimming and even swans there on top of the water. It's a lovely thing to see. Finally, people across the world are thanking the real heroes in all this, the healthcare workers on the front lines of this pandemic, working in all kinds of different and difficult conditions. And celebrities in New York are now adding their own heartfelt thank you.
The message for all the healthcare workers out there.
To all the healthcare workers, thank you.
We all want to thank you.
We all are feeling a tremendous amount of fear and uncertainty at a time like this. You're not immune to that, I know, and yet there you are.
There you are on the front lines for all of us fighting this coronavirus, and I can't even tell you how much I appreciate you.
Thank you so much for everything you guys are doing to keep us all healthy and safe.
Thank you for being there.
Thank you. Thank you from the bottom of my heart.
Our sincere thanks to them as well. This was your Good News Roundup. Stay safe and be good to each other.
Our thanks indeed to those on the front line of this battle. And before we go, our image of the day, an extraordinary sight from Rio de Janeiro, Christ the Redeemer, the statue all lit up with the flags of the countries affected most by the coronavirus, and there are a lot of them. The landmark was shut down to the public earlier this week as a precaution, but Brazil's Archbishop held a mass at the site asking people to pray for the sick around the world. A powerful display of unity and a timely message during this most uncertain time. And before we go, a quick reminder that this is the first day of spring. Here's hoping to brighter days ahead. That is our show for this hour. Be sure to stay tuned to ABC News Live for more context and analysis of the day's top stories. I'm Lindsay Davis. Thanks so much for streaming with us. Good night.